Welcome to our Lively U Virtual Learning Academy. On behalf of the Wood County Committee on Aging, we welcome Dr. Thomas from McLaren St. Luke's Family Medicine Residency Program. And the topic today is cold and flu season.
Perfect. Well, thank you guys for having me. And as mentioned, we are going to talk about cold and flu. What's important to me is I don't want to take too long on the presentation aspect because I want to make sure I have enough time for everyone's questions. But it's chiefly about how to identify the difference between cold and flu and essentially the things that we can do to protect ourselves going into this flu season. So let's start out with what is flu. So influenza is a virus that can cause an infection of the nose, throat, and lungs. And then the symptoms that are that we typically see with it vary from fever, headaches, fatigue or tiredness, dry cough, sore throat, runny nose, stuffy nose, and muscle aches as well. In particular, and I'll talk about this later, what kind of distinguishes it from regular cold virus or the viruses that may cause cold is the fever, chills, and headaches, which are more specific. The reason why we care about this in the first place is in our older populations, we are more concerned about complications of flu, which include pneumonia, dehydration, and worsening of their chronic medical condition. So patients who may have something known as COPD or chronic obstructive pulmonary disease are at increased risk for some of these complications. So what can we do to prevent the flu? So the thing that we do every year is the CDC and WHO tries to follow the different types of flus that are going on around the world and to make a vaccine that they think will best cover the type of flu virus that will be going on around in the next season, which is why we get flu shots every year. Things that we can do to help as well as getting our flu shot is avoiding contact with sick people. If you're sick, definitely stay home because you don't want to get anyone else sick. And kind of the same things we've been doing in the pandemic, keeping your mouth and nose covered and washing your hands. And then avoid touching your eyes, nose, and mouth because that's kind of how it can spread if you come into contact with a virus and you introduce it in those different areas. So what's the common cold? So the common cold is caused by a different virus. There are actually a multitude of different viruses that can cause it. But the main thing is, although the symptoms may be similar, they are milder for the most part. What's rare, and again, as mentioned before, are headaches, fever, and chills, and the common cold, which are common in a flu virus. So how do we tell the difference? So it's often difficult without running tests. If you become sick within the first few days, you can be tested for the flu via a nasal swab. And in that case, the doctor may examine you as well because there are sometimes, if you have the flu, it increases your risk for bacterial infection on top of that. So it may be important for your doctor to examine you to make sure you don't have that going on because that would require antibiotics. But just to be clear, in this case, since we're talking about viruses, the things that we use for them is more symptomatic treatment. So what do you do if you get sick in this season? So resting and drinking plenty of fluids, avoiding the use of alcohol and tobacco because these can actually exacerbate some of the lung-related symptoms, or in the case of alcohol, it can dehydrate you. Humidifying air if you are having a dry cough, gargling or using saline nasal sprays. And then if you see your doctor, they may prescribe you some medications. The most common one used for flu is Tamiflu, if it is found that you have that in that case, and it's found to reduce the amount of symptom days by 1 day if you take it within the first 2 to 3 days. So as mentioned before, for treatment of most viruses, we treat it symptomatically. So some of the things we use here are like Tylenol, or ibuprofen, which falls in the category of analgesics, which help relieve pain, some of the muscle aches that you can get with flu and fever. Antitussives are medications that help us stop coughing if we have a cough as one of our symptoms. If you have a lot of congestion, then you can use a mixture of what are called expectorants or decongestants, which basically help thin the mucus and reduce nasal swelling to relieve that congestion. And then you can also use nasal sprays, which have a similar purpose. So this is just a chart to demonstrate the differences between cold and flu. I would just like to draw your attention to the things on the cold side, on the left side of the screen, that are rare, which I had mentioned before: the fever, the headaches. And you usually don't get extreme exhaustion with cold like you may get with flu. So again, it's a distinguishing factor. With cold, there's really nothing we can do prevention-wise for it. As far as a vaccine goes, besides washing our hands, keeping our nose covered, trying to not touch our hands and mouth, and staying clear of people who may be sick. Whereas flu, on the other hand, as mentioned before, you will get those fevers, headaches, muscle pain, or muscle aches, I should say, and fatigue associated with it. So this is just a brief chart to just demonstrate, when we talk about vaccination for flu, sometimes it's a common thing that patients will say, well, I got my flu shot and it gave me the flu. And this is a common misconception, because it's actually known, and we expect that when you get a flu shot, for you to have some redness and swelling in that area. You may get headaches, fever, and fatigue, which are similar symptoms as flu, but this is actually your body's natural reaction to anything foreign, and we're trying to introduce a part of the virus into you, so that your body will make, your immune system will be prepared for it if you encounter it in the future. So this is not actually giving you the flu per se. This is actually just your body's own natural reaction. And then lastly, it's really hard to predict who will have what symptoms. So this chart is just to basically to demonstrate all the different factors that may influence an individual's experience after a vaccination. And age does play a factor. Generally speaking, our older populations do not have as severe reactions as your adult populations, like 18 through 50 years old. And that's because the immune system starts to wane in the older population. But as shown here, there's many different factors that can influence this, so it's very difficult to predict. All right, so that kind of takes care of most of the topics I wanted to cover. So I kind of wanted to open it up for any questions that are specific. And then also, it would be remiss of me not to acknowledge the fact that we are in the middle of a pandemic. So obviously, COVID being a separate virus kind of plays into some of the anxieties with sickness going around this season. So if there's any questions, then I open the floor.
Perfect. Thank you, Dr. Thomas. At this time, we are recording this presentation, so we will be sharing it on our YouTube channel.
Sure.
So just as a note, you mentioned a little bit about the cold and flu viruses, and I know that people have a hard time maybe distinguishing when to go if they think they may have COVID. So
sure.
Is there a way that you can indicate when you may need to go to the hospital or to the doctor?
Absolutely. So the symptoms we really get concerned with, especially with COVID, are shortness of breath. If a patient is beginning to get sick and is starting to have difficulty breathing, certainly decreased fluid intake, and feeling extremely dehydrated, extremely exhausted, those are things that would prompt that patient to want to go in to be evaluated. And certainly it's better safe than sorry. It's great to have someone come in and it just be the common cold. But really the only way to distinguish between, the flu, the common cold, or COVID is through a nasal swab. And the type of swab they use does test for a multitude of viruses, which include those three. So.
Perfect. And another question too, is we focus a lot on symptom management, but what would be your recommendation for prevention? Do you have any vitamins, tips, or tools on prevention?
Sure. So there's some evidence that shows with viral infections, increased uptake of zinc may help with that. But generally speaking, trying to stay healthy, like exercise, things like that also helps a lot with keeping your immune system strong and helping prevent worsening infection of any type, whether it's a common cold or the flu. So that's always important and something that we recommend.
Right. And obviously probably getting a lot of rest as well might be helpful.
Yeah, absolutely. Yes. Fluids, rest is kind of when our body is fighting any infection, it kind of can, our process of helping get rid of it can dehydrate us in the process when we have runny nose or if we have diarrhea or things like that. So it's important to stay hydrated and maintain proper electrolyte balance.
Perfect. I think that's a great way to kind of summarize how we can kind of get through this next season, this winter season coming up, and hopefully everyone stays healthy with your tips. We appreciate your time this morning, Dr. Thomas, and we will be back again next month for another topic from St. Luke's Medical Family Residency. Thank you so much.
Perfect. Thank you for having me.
Thanks,